If you are like a lot of Chattanoogans and those who live in surrounding areas, you're going to take advantage of the beautiful spring weather, get out and maybe work in the garden, do some running, and it's very possible that you may hurt your knee in the process. Dr. Jeff Hall is here this morning with the Chattanooga Integrative Medicine Center to give us a bit of an education on knee pain specifically, but perhaps we'll be lucky to talk some overall health issues as well. Good to see you back.
Thanks for having me back.
So I guess when you first began to come on the show, Jeff, we focused on knees because you kind of specialize in that area. People hurt their knee a bit if they're a weekend warrior out running, have a tear or something, and there are all different ways to look at a problem within your knee, right?
Yes, the majority of the knees we get are either the injured knee or the degenerated knee. People that have been told they need a knee replacement.
Okay.
Or people that have been told they need a scope.
You are not a person who says that you never need a knee replacement.
Correct.
But you do believe that there are lots of things that you can do to put that off as long as possible, if ever.
Yes, regenerative medicine is allowing us to save a lot of people from knee surgeries, because what it does is that we inject regenerative cells into the knee and it literally regenerates, grows new cartilage.
Okay, now by that are you meaning stem cells?
Yes, stem cells.
So are those your own stem cells? Like if I came in to see you and I said my knee's really bothering me, would you automatically consider stem cells for me, or would you have to kind of see what's happening inside my knee and make a best judgment?
A lot of it's age dependent, because usually if you're an older patient, taking your own stem cells doesn't work as well as using donor placental or umbilical cord stem cells, because they have a higher concentration of stem cells than we do, being over the age of 30.
Okay.
So a lot of it's case dependent on the age of the patient and the severity of the condition, how worn out the knee is or how injured the knee is.
Okay, so what type of injury are we talking about? Is this when you hear about bone-on-bone pain? Is that the kind of person who would need to have or be a candidate for the stem cells?
Bone-on-bone pain usually, yeah, they're pretty far gone by that point. But a lot of people get diagnosed as bone-on-bone and they're not truly bone-on-bone. There's still some cartilage in the knee joint to put the regenerative medicine in there and regenerate the cartilage. But yeah, if it's true bone-on-bone, there's no cartilage left, so it's kind of tough to regenerate something that's not there.
Okay, so how does someone know when to come in to see you? What are some warning signs that this is a problem that can be dealt with successfully?
Well, pain going up and down stairs is a big one. Pain around the knee itself, stiffness in the morning in the knee joint, pain with activity, any of those would be strong indicators to get in as soon as possible so we can save your knee.
If you have a problem with one knee, then does your other knee compensate, and then with time it begins to have problems too?
It does, because you start putting the weight on the other knee. Because if, say, your right knee hurts, then you're going to put more weight on your left knee to kind of take the pressure off the right knee.
Right.
So most people wear down their knees at the same time. Like, we rarely get someone that comes in and just one knee's worn out but not the other.
Right. So when they come in to see you, if they're having any of these experiences, and by the way, do you have to have been, an athlete out there running a 5K every weekend, or does this just happen with age? Some of this?
It's age dependent. Some people are just more prone to having knee problems. Obviously, athletes can wear their knees out quicker if they're not taking the right nutrition or, rehabbing the knee correctly.
To that end, since you mentioned nutrition, does a healthy diet go a long way towards protecting and preserving the cartilage we have?
I would say a healthy diet helps protect and preserve everything we have, so that's always where we start. But even we see people that come in and have lived healthy lifestyles, have healthy diets, they still have knees that are degenerating or, shoulder tear or stuff like that.
Now, does the stem cells that you're talking about, is that just for the knee, or you mentioned your shoulder? Can it work in other parts of the body?
Yes, the knee and the shoulder seem to work the best, but we've even been using it in the back, some in the neck area.
How does the process work when they come in to see you? Is it a series of injections? How does it happen?
No, it's not a series. It's usually they come in, we analyze, find out what the problem is. Most patients, they've been told they need a knee replacement or they've got a torn rotator cuff. So we evaluate the severity of it, and then we choose the appropriate regenerative medicine to put into the area to regenerate the area.
And how long does it take before, like but you are injecting it, right?
Yes.
The stem cells are injected?
Yes.
So once that happens, how long before they begin to feel different?
Some people it's overnight.
Really?
Yeah, some people 2 to 3 days. Some people it takes the full 8 weeks. Because really it works best over a course of 8 weeks. Because say you break your hand, how long is it going to take to heal?
Right, I don't know.
About 8 weeks.
Okay.
So it works the same principle, that it regenerates over a course of 8 weeks.
And in the course of that time, are they coming in to see you to be evaluated?
Yes, we do like to follow up. I'm not the kind of doctor that just injects something in someone and say, all right, see you later.
Right.
I like to watch their progress. Usually we'll have them come back a few times to see how they're improving and help them maybe do some exercises to re-strengthen the area they're regenerating.
I realize in this particular case, probably, it's not your own body that's doing the healing because the stem cells are coming from an outside source. But you are a believer, aren't you, that the body is meant to be able to heal?
Absolutely. The body's a self-healing organism. If you cut your arm and just clean it out with soap and water and do nothing else, it's going to heal. So other parts of our body are the same way to a certain extent. And
not to tell people to avoid a surgery if that's what's needed, but the body is also a circuitous creature, right? So if you alter one part of it, the ripple effect will spread to other parts of the body?
Yes. And one of the points is surgery is going to be a lot less utilized in the future due to regenerative medicine, because if people come in early enough and start regenerating the tissue, they can avoid surgeries down the road. Because some people, you're right, if they're too far gone, if there's no cartilage in the area at all, then it's tough to regenerate. So we try to educate people to, even regenerate before.
Like a proactive step, like a preventive measure?
Well, yeah, as soon as the knee starts hurting, or don't let it go 20 years and then, oh, I think I better do something about it.
Now, within the scope of the practice, before I let people know how to find you, a lot of kids are going to be out on the football fields practicing over the summer, just sports camps, you name it. Injuries occur. Within the office, you do other types of practicing besides just the stem cells, right?
Yes, we use cold laser, hot laser, do adjusting.
What was it that you used on me that day with my shoulder?
That was the cold laser.
That's the craziest thing. I can still sleep on my left side.
Yeah, most of our athletes totally respond to that and are back out in the field in a few days. Okay,
you accept insurance?
Yes.
So here's how you can find him. Dr. Jeff Hall at Chattanooga Integrated Medicine Center over on Shallowford Road. 499-0003 is the phone number. Online, integratedmedicincenter.com. And again, today he was talking about the stem cells that he's able to do with this regenerative growth, but they've got a whole plethora, if you will, of services they can offer. Great to see you back.
Good to be here. Thank you.